Hello everyone. In this video we will be seeing about pelvic tilt. Definition: a line joining ASIS and PSIS and horizontal line making an angle known as pelvic tilt. Normal value of angle is 11 degree plus or minus 4 degree. Flexion and extension occur in sagittal plane and coronal axis. Abduction and adduction occur in coronal plane and sagittal axis. Rotation occurs in transverse plane and vertical axis. The pelvic tilt is of 4 types: anterior pelvic tilt, posterior pelvic tilt, lateral pelvic tilt, and pelvic rotation. In anterior pelvic tilt, ASIS moves anteroinferiorly and downward. Pubic symphysis moves posteriorly and moves closer to the femur. ASIS aligned horizontal with PSIS and vertical line with the symphysis pubis in normal alignment pelvic. It changes in anterior pelvic tilt. Sacral angle increases and the lumbar lordosis and the thoracic kyphosis also increases. Abdominal muscles and the hip extensor muscles are responsible for preventing the anterior pelvic tilt. Contraction of hip flexors and spinal extensors result in anterior pelvic tilt. Posterior pelvic tilt, ASIS moves posteriorly. Pubic symphysis moves away from the femur. Spinal extensors and hip flexors are responsible for preventing the posterior pelvic tilt. Contraction of the hip extensors and the spinal flexors result in posterior pelvic tilt. Sacral angle decreases and lumbar lordosis also decreases. Anterior and posterior pelvic tilt can be measured by the following ways. Lumbosacral angle. A superior border of the sacrum and a horizontal line makes an angle known as lumbosacral angle. Pelvic inclinometer. One arm of the pelvic inclinometer is placed over the pubic symphysis and another over the PSIS. Normal angle is 30 degree. Vertical line. The vertical line drawn from the PSIS to the pubic symphysis align in the same line. The alternation in which is said to be anterior and posterior tilt. Lateral pelvic tilt and drop. Both ASIs aligned in the horizontal line in normal pelvic. If any changes occurs in this alignment said to be lateral tilt or drop. Possible during unilateral and bilateral stance. In unilateral stance, one hip is flexed and the another is freely moving and result in drop and hike. Hiking. In normal person, the hip hiking occurs while clearing the foot from the ground. During hiking, ASIS moves upward and medially. Spine goes for flexion in same side. Hip goes for abduction in the hiking side. Hiking occurs due to contraction of the quadratus lumborum and the spinal side flexors. Dropping. ASIS moves inferiorly and medially. Spine goes for opposite side flexion. Hip goes for adduction in the drop side. Pelvic drop occurs due to the opposite hip abductor's weakness. This sign is called as Trendelenburg sign. Both the sides abductor paralysis leads to waddling type of gait, also called as duck walking. Pelvic rotation occurs when the swinging leg moves forward and backward on supported or stance leg. For example, in normal walking, the forward motion in the right side leg results in the right side pelvic forward rotation. Left side upper limb swings forward and the stance or the weight bearing hip goes for the medial rotation. In case of the backward motion, the right leg results in the backward rotation of the pelvic. Right upper limb swings forward and the stance or the weight bearing hip goes for a lateral rotation.